So hi, so I'm here with Dr Abigail Moore, who is a paediatric dentist.
Mm-hmm.
Yes?
Yeah, brilliant. Thanks for inviting me.
Yeah, absolutely thrilled you're here, because we get so many questions about dental care. Like, so when is it a good time to start brushing their teeth? Is it a big question?
A big question,
Yeah.
I know. Well, I'm delighted because I just love spreading the word.
Yes.
You're the perfect people for me. So the biggest thing about teeth is if there is a tooth, it needs to be brushed.
Okay.
It's very simple, because the minute a tooth erupts into the mouth or comes into the mouth, has a little film over it, and bacteria instantly can attract to that.
Okay.
So as soon as it's there, we need to brush it
Even if
up.
they're not weaning, even if they're not eating food.
Even if, absolutely, no matter what, because no matter what, they're getting food and drink into their mouth.
Okay.
So if they're having anything into their mouth, then they can get bacteria and then they can get cavities, even really early. Yeah.
So do you mean like getting a toothbrush into their mouth at like 3 months?
Well, I mean, you could give it a go. Some kids may be more compliant than others.
Yeah.
But no, I mean, something simple, like even, the muslins that you use, you can just damp that and rub, because they've got quite a bit of roughage, quite a bit of texture in them.
Okay.
So you could rub the teeth with that. There's special little toweling finger puppet things called spiffies that are great as well.
Okay.
They're great. But don't go buying anything special.
Okay.
Just a clean, damp muslin is perfect.
And toothpaste. Do they need toothpaste?
Well, no, I probably wouldn't introduce toothpaste until about 2 years of age.
Okay.
That's more the toddler kind of time, because that contains fluoride, and also it's quite strongly flavoured. So until children are well established on food and different flavours, they would find that a little offensive.
It would be very, very strange putting toothpaste into a child that hasn't weaned and it's just on milk.
Absolutely. I think so. No,
so
and
it's
also
about cleaning it. It's
just about cleaning it, just about getting the actual physical. There's almost like a little, a rough texture that appears on the teeth. You just need to get that off.
Okay, wow. I don't think a lot of people know that actually.
No.
And I think they think, oh sure, they're not eating food, so I don't need to keep.
I know. I've met kids that have never brushed their teeth until age 4.
Oh no.
Because the parents just didn't realise,
And actually, I think as part of the cleaning teeth, I think you start a routine early. So I would have always been keen on routine.
Yes,
so I would have been keen on feeding routines, but also bath time routines. And then we kind of started brushing the teeth early.
Yeah.
So we always brush the teeth at night. We always brush the teeth in the morning.
Yeah.
So it's kind of for my kids, I don't think they know anything different. I feel like they don't know anything different.
And if you forget, they might remind you even.
Yeah.
Exactly, yeah.
So it's sort of, if you have that bedtime routine that you can add, brushing their teeth. Yeah. Now, one issue maybe mum has with a baby that's either breastfed actually or bottle fed is that you tend to put the baby down with the milk. I know. So it's not really appropriate then to be taking them back up to clean their teeth.
No, so you're nicely almost asleep now. Let's brush your teeth.
Brush your teeth.
No, and I think we have to apply, common sense to this as well. I mean, you're not going to wake up your almost sleeping baby. So of course our advice is always brushing in the morning, ideally about 20 minutes after breakfast if you can,
Okay. Why is that?
Just because if you've had any sort of fruit at breakfast or anything like that, you want to give the saliva time to neutralise the acid.
Okay.
So you don't want to eat an orange, brush your teeth.
Okay.
Because actually, if you eat an orange, you're putting acid on the enamel and weakening it a little, and then if you brush it off, you're more likely to get erosion, like loss of enamel. Anyway, that's a whole other topic. But just ideally, if you could do first thing in the morning, after breakfast, about 20 minutes after breakfast, or first thing in the morning before breakfast, even before you have the acid attack, and then as close to bedtime as possible. Okay. And the most important thing is to not eat afterwards, and certainly nothing that could be causing tooth decay. But you have to be sensible, and children ideally are only having a bottle of milk up to what age? What age do you advise?
So it's 1,
yeah. So if they're having a bottle of milk and brushing their teeth before that, up to age 1, I think we're okay.
Yeah.
It's when we get into children who are 3, who are 4, who are going to bed with a bottle of milk, keeping it in their mouth all night, and the teeth are constantly covered in milk. That's the problem. So
again, and I have heard you talk about this before, is we all want to kind of have a baby that sleeps through the night and doesn't feed. Yeah. But that's where it is dangerous, where they are drinking that milk, or maybe drinking even breast milk. Like, I think people kind of think, it is amazing to be able to breastfeed.
And it is,
However, that constant erosion of the teeth during the night isn't good either.
No, it's not. You see, and I suppose nature, will have designed babies such that they are feeding during the night until they have other nutrition. So you'd like to hope that once they're weaned and they're having good solid foods, they don't need as much food during the night. But yes, any sort of food or drink on the teeth even if it's something that we all know is amazing, like breast milk, it still has sugars in it, and it still can damage the teeth. But a breastfeed, going to bed, a breastfeed first thing in the morning, that's okay. It's really during the night is the problem. When your saliva rates are much lower, the teeth are dry, so anything that sits on the teeth is really staying there, you know.
And I think another big part of what I teach at wean is that you kind of try to have your set meal times. And that you have your carb, your veg or fruit, and that you have your carb, fruit and veg. What's the one? Your protein.
Protein. That one.
Got it in my head. But like when I say that, I kind of, when you have your snack, if you have like a cracker and cheese and a slice of apple, isn't that better than sitting down to all apple? At a snack time, or is that? Well,
you see, the area of nutrition and dentistry sometimes is a little bit at odds with each other.
Yeah.
For the teeth, it's all about food-free time.
Okay.
So it's not so much about what you eat; it's about how often you eat it.
Yeah, and I guess I meant that's what I kind of was trying to come to. That it's like a set. So what I say you should have is like a breakfast.
Yes.
And that breakfast then might have fruit with it.
Absolutely.
So you're kind of eating them together.
Exactly. Yeah.
And then your the dinner is I call it dinner 1 and then dinner 2.
Yeah.
So you have 2 dinners, and then maybe at 9 months then you might have 2 snacks at the mid morning and mid afternoon.
Okay.
So many times you're eating there, you're eating 3, 4, 5 times.
5 is perfect.
So that's what I have heard you say before, because there are mums that run into the trouble, and I know myself. I remember Jessica was always coming up to me saying she was hungry.
Oh, I know.
And it's really difficult, and it's very easy then to just give them snacks.
Something you think is healthy as well. I give them a banana, I give them an orange, but the problem is that's an acid attack. It's an acid attack. 5 acid attacks. Like they've done so much research on it, and they have these fantastic graphs of how the pH goes up and down in the mouth, and they have shown that the teeth, the enamel, which is really strong, but it can only withstand 5 acid attacks a day. So outside that, no matter what they're eating or drinking, is an issue. I filled it in once for one of my children, and I think he ate 20 times in one day.
Oh wow!
And I was thinking, I'm going to be great at this.
Yeah.
And actually, it was constant. It was constant. A little cracker, a little thing.
Yeah. You're out having a coffee with friends, and you're just handing them.
Absolutely. Here's a bit of cheese. All stuff that I perceived as healthy, but it was the frequency that was the problem. So we all fall into that trap. It's really hard.
It is really hard. It is really hard. But I do think that, and I have this rule with my kids, is that when they come home from school, they get a snack. But then there's it's all at one time, and then there's no more snacks until dinner. Yeah. And actually, I wasn't doing that for the teeth. I was actually doing that because they're not hungry for dinner if they eat an hour before.
Yeah. And also they tend to learn to train train their bodies that they eat a little bit more on those occasions, so they're not relying on the constant, which I'm sure nutritionally must be much better for them as well.
Absolutely. Absolutely. Yeah, because their tummies are so small. And it's kind of about the optimal nutrition at that one time.
Yeah.
And then finally, I would always be saying that it's milk and it's milk and water.
Yes.
And actually, the only reason we might need fruit juices or anything like that is that it's introduced outside of your control, because it was for me, because I was absolutely milk and water, and suddenly they were going to karate, or they were going to a party, and it was out of my control.
It's so hard.
I think in the house, if you just stick to milk and water,
just don't buy it.
No,
the only way is to not have it. If you have it in the fridge, if you have the the mywaddy in the cupboard, even the no added sugar one, the kids will know it's there, and they will wear you down.
They will wear you down.
So no, and I suppose as well, I mean, do they need juice? A lot of parents will say to me, but it's organic and it's fresh, or it's freshly squeezed organic, pink grapefruit juice. And I think, well, that sounds very nice, but then I go through, maybe talk about the diet a bit more, and they're actually having fruit then 5 other times a day.
Because that's an acid attack when it's in the drink.
Absolutely, Okay. But do they need it anyway? So I suppose if they're getting their fruit and vegetables in the way they should, as whole fruit and vegetables, they don't need the juice anyway. So I think mums are only trying their best, mums and dads, but they don't need it. Milk and water is. It's really the only thing.
I think it's good advice, and it's good advice to start with. Absolutely. That, hard to
Because who wants to drink water when you can have juice?
Yeah.
You know.
So show us what you have here. We're obviously not brushing with this.
This is for the babies. Okay, so I just brought in a couple of little things. Whoops. Now, this is my all-time favorite toothbrush. Okay,
I've never seen
I
that.
know, it looks like an amazing contraption. These are the Dr. Barman's toothbrushes. Okay, so they're quite hard to get. You can get them online if you just Google Dr. Barman's.
Brilliant.
But what these do is these clean the inside and the outside and the top of the teeth all together.
Okay.
So these would be my go-to brushes for toddlers.
Okay.
Okay, so because toddlers, if you think about it, they've got 10 teeth on the top, 10 teeth on the bottom. Some of them are quite far back. So if you're trying to clean the inside, the outside and the top with a normal sort of small soft toothbrush, you're doing a lot of manoeuvring.
Yeah.
Whereas this...
And they're not letting you open their mouth.
No, well that's it, that's it. So I mean it's hard to show you on this model with this particular brush, but you can sort of get an idea that it's cleaning...
Just move this into the center here. Yeah.
This is cleaning the inside and the outside. Actually, hang on, I do have a little model for that. Can I grab it?
Yeah.
Yeah. So, just have another little one. Felicity has an eye. Now, actually, here we go. So I'll just show you on this little model here. So do you see this does the inside?
Oh wow!
And yeah, it's actually phenomenal.
And can you? Would that be good for like an older child?
Yeah, it is. So you can get this in a child size, which is this one, and I'd say that would do them up to about 6. And then when they start getting their bigger adult teeth, there's a bigger size of brush as well. Yeah. But honestly, you can do 5 seconds at the back, 5 seconds at the front, 5 seconds at the back again. You can probably do the whole mouth in a minute, you know. And when you have a child that's squirming around as well, and I would always recommend standing behind them.
I was just about to say, that's why I used to tilt them back a bit.
Absolutely. Yeah. So if you sit on the edge of the bath, or even if you just stand and they tilt back on you, and you can just support their head, and you can just do that. Yeah. Otherwise, you're killing your back trying to do that, you know. So
I also used to let them play a little bit with it.
Yeah.
So that they get used to it, or that they didn't have a negative. Because if you kind of come in with something at them and don't let them have it, they're like, I don't want that.
No, I would normally give it to them first. So if you're talking about a 2-year-old, you're going to put a little bit of toothpaste on it. So put a little bit of toothpaste. Always squidge the toothpaste into the brush. Okay. Because if you leave a dollop on the top, they just eat it. You know, which is inefficient. and tastes lovely. You know, not really. There's not much point in that. So squidge it into the brush and then let them have it first. Sure, at that stage they've got it all in their mouth, and then all you're really doing is the physical plaque removal. You know. So that is my go-to. They have changed so many parents' lives. You know.
That's brilliant. And at what age do you let them do their own teeth?
Oh, listen. I mean, never.
I'm brushing my 21-year-old's teeth.
No, I mean they have this sort of go-to rule that if they can tie their own shoelaces, they can clean their own teeth.
Okay,
but I know
Jessica's still struggling with this.
Well, my 8-year-old can tie his own shoelaces, but every night I brush his teeth. Because I mean, how can you be sure they're getting at those new adult teeth at the back? You know, so I think really you know your own child. You know your own child. And also what I would always advise to parents before they go to the dentist is if they're brushing themselves, let them brush themselves that day. Okay. And then when they come in, we can say, oh, actually the brushing isn't great, or you know, we can tell the child then and then encourage the child to
so
allow,
don't go and brush their teeth that one day that they're going to the dentist.
No, sometimes they come in and they say, I've brushed my teeth 3 times today.
That's not really.
And then they're still not great. I'm thinking, but yeah, no. So I would say that let the dentist kind of have a look at that, or the hygienist as well. Do you know?
Brilliant.
Yeah.
I think that's fantastic. I think we've learned a lot.
There was one thing I wanted to show you as well. Okay, so just before I forget, this is a nice toothpaste, but honestly the brand doesn't matter. It can be, you know, Aldi, Lidl, Tesco. Doesn't matter. Doesn't matter, right?
Really, so you don't have to go for the expensive brands.
No, and the age doesn't matter either. Okay. The most important thing is that the child likes the toothpaste, because what we don't want to do is we don't want to rinse out after brushing. Yeah. So we want to just put it on the brush the teeth, spit out, and leave it. And if they hate the taste of it, they'll want to rinse. Yeah. Okay, because you're actually washing away all the fluoride if you rinse it out. Okay. And then there's no point. Okay. You know, so if you're going to use toothpaste, use it properly. So a little bit on the brush the teeth, spit out, don't rinse, okay? And make sure it is a fluoride toothpaste. Okay. And the age, as I say, doesn't matter once they like the taste of it. The only important thing is when you are looking at toothpaste, there's going to be an ingredients on it, and we need to make sure that the amount of fluoride, which is the bit that says contains sodium fluoride, we need it to be more than 1,000 once we're over age 2. Okay. So that can be any toothpaste, and once they get to sort of 3 or 4, we want it to be over 1,400. Okay. And like a lot of kids, a lot of children that have more sensory input in their mouth will not like any of the strongly flavoured ones. But this one is only age 4 to 6. This is fine for a 10-year-old. Doesn't matter.
And are you okay with, like my kids have started using my toothpaste sometimes?
Fine, yeah.
Just as long as they don't swallow it.
Well, it's the same strength, you see. This is
it?
that's the thing. So the adult toothpaste is the same amount of fluoride as this toothpaste. So all of our toothpaste. The only difference is that we like clean, fresh taste, and kids hate clean, fresh taste because they think it's spicy. You know.
Okay.
So they can use. So if they like the spiciness of it or the mintiness of it, they can use.
Actually. They prefer it. Yeah.
But a lot of people get told by their dentist to use adult toothpaste because it's the full strength, but actually this little 4 to 6 is the full strength as well.
Okay, excellent. Thank you so much.
Okay, brilliant.
Thank you.
Thanks, Emil.